Normal cervical cytology. Cervical cytology is the microscopic examination of cells exfoliated or mechanically collected from the uterine cervix. Accurate interpretation begins with recognition of normal cellular morphology because every cytological abnormality is identified by deviation from the normal appearance of cervical cells. A routine cervical smear contains squamous cells from the ectocervix and vagina, endocervical columnar cells from the endocervical canal, squamous metaplastic cells from the transformation zone, and, in appropriate clinical settings, endometrial cells. Background elements such as histiocytes, inflammatory cells, red blood cells, mucus, and lactobacilli may also be present. The proportion of these cells varies with age, hormonal status, menstrual phase, pregnancy, menopause, and the site sampled. Understanding these normal variations is essential before learning the Bethesda reporting system. In this lecture, we will systematically identify the normal cellular populations encountered in cervical cytology and the key morphological features used to recognize them. Normal squamous cell population. Squamous epithelial cells constitute the majority of cells seen in routine cervical cytology. They originate from the stratified squamous epithelium of the ectocervix and vagina and represent successive stages of epithelial maturation. As cells migrate from the basal layer toward the epithelial surface, they mature from basal cells to parabasal, intermediate, and finally superficial cells. With maturation, cell size and cytoplasmic volume progressively increase, while the nucleus becomes smaller, more condensed, and the nuclear to cytoplasmic ratio decreases. Superficial squamous cells are the most mature cells encountered in cervical cytology. They are large, flat, polygonal cells with abundant thin cytoplasm that stains eosinophilic or orangeophilic, although cyanophilic forms may also occur. Their small pycnotic nucleus produces a very low nuclear to cytoplasmic ratio. These cells predominate under estrogenic influence, particularly during the periovulatory phase. Intermediate squamous cells are usually the predominant squamous cells in routine cervical smears. Compared with superficial cells, they have thicker cyanophilic cytoplasm, a larger vesicular nucleus, and frequent cytoplasmic folding while maintaining a low nuclear to cytoplasmic ratio. They predominate during progesterone-dominant states such as the luteal phase. A specialized intermediate cell is the navicular cell, characterized by abundant glycogen, a folded or boat-shaped outline, and an eccentrically placed nucleus. Navicular cells are commonly seen during pregnancy and represent a normal progesterone-related change. Their glycogen-rich cytoplasm should not be mistaken for coilocytic change. Parabasal cells are smaller round to oval cells with dense cyanophilic cytoplasm and a relatively higher nuclear to cytoplasmic ratio than intermediate or superficial cells. They are normally encountered in hypoestrogenic states such as childhood, lactation, and postmenopause. Although their nuclei appear relatively large, they remain uniform with smooth nuclear contours and finely granular chromatin. This distinction is important because benign parabasal cells may mimic high-grade squamous intraepithelial lesions. Uniform nuclear morphology favors a benign parabasal cell, whereas marked pleomorphism, irregular nuclear membranes, and coarse hyperchromatic chromatin suggest epithelial abnormality. Basal cells form the deepest layer of the squamous epithelium and normally remain attached to the basement membrane. Consequently, they are not expected in routine cervical smears. Cells interpreted as basal cells are usually parabasal cells, and true basal cells are seen only in the presence of significant epithelial disruption, such as trauma or ulceration. Recognition of the normal squamous maturation sequence forms the basis of cervical cytology. Once the maturation pattern is identified, the observer can distinguish normal physiological variation from genuine epithelial abnormality with much greater confidence. Normal endocervical and squamous metaplastic cells. Normal endocervical cells originate from the mucin-secreting columnar epithelium of the endocervical canal. Their presence indicates endocervical sampling and, when accompanied by squamous metaplastic cells, supports sampling of the transformation zone. These cells typically occur in cohesive sheets or strips and display two characteristic architectural patterns. In the honeycomb pattern, the cells are viewed on face, producing a flat monolayer with uniform, evenly spaced nuclei and distinct cell borders. In the picket fence or palisaded pattern, the cells are viewed laterally, showing columnar cells with nuclei aligned along the basal aspect of the group. These orderly arrangements are characteristic of benign endocervical epithelium. Individual endocervical cells are columnar to cuboidal with pale mucin-containing cytoplasm and uniform round to oval nuclei showing smooth nuclear membranes, fine chromatin, and inconspicuous nucleoli. In liquid-based preparations, the cell groups may appear smaller and more compact, but their orderly architecture and nuclear uniformity remain preserved. Squamous metaplastic cells arise within the transformation zone as columnar epithelium is replaced by squamous epithelium. This is a normal physiological process and should not be confused with dysplasia. Because the transformation zone is the site where most cervical precancerous lesions develop, accurate recognition of normal metaplastic cells is essential. Mature metaplastic cells resemble intermediate squamous cells, but generally possess denser cyanophilic cytoplasm and slightly smaller nuclei. Immature metaplastic cells are smaller with a relatively higher nuclear to cytoplasmic ratio. However, they retain smooth nuclear contours, fine chromatin, and overall nuclear uniformity. These preserved benign features distinguish them from high-grade squamous intraepithelial lesions. The key principle is that both normal endocervical and metaplastic cells maintain orderly architecture, uniform nuclei, smooth nuclear membranes, and finely granular chromatin. Recognition of these benign characteristics prevents overinterpretation and provides the foundation for identifying glandular and squamous epithelial abnormalities in subsequent lectures. Normal endometrial cells and benign background elements. Normal endometrial cells may be present in cervical cytology specimens, particularly during menstruation and the early proliferative phase, when physiological endometrial shedding occurs. They appear as small, compact three-dimensional clusters of glandular cells with scant cytoplasm, round to oval nuclei, and finely granular chromatin. Endometrial stromal cells may accompany these clusters as small cells with scant cytoplasm and relatively dark, uniform nuclei. Recognition of their characteristic morphology and appropriate clinical setting helps distinguish them from glandular epithelial abnormalities. The Bethesda reporting recommendations for benign endometrial cells will be discussed separately in a later lecture. In addition to epithelial cells, several benign background elements may normally be encountered. Histiocytes are large cells with abundant foamy cytoplasm and an eccentrically placed nucleus and are commonly seen during menstruation or following physiological tissue breakdown. Red blood cells, mucus, and small numbers of neutrophils and lymphocytes may also be present and should always be interpreted in the appropriate clinical context rather than as evidence of disease. Lactobacilli are the dominant normal vaginal flora in women of reproductive age. By metabolizing glycogen released from mature squamous cells, they help maintain the acidic vaginal environment. Heavy colonization may produce physiological cytolysis, in which the cytoplasm of intermediate squamous cells dissolves, leaving numerous bare nuclei within a granular background. This is a normal finding and should not be confused with necrosis or tumor diathesis. Recognition of these normal background elements is an important part of cervical cytology because they provide the physiological context in which epithelial cells are interpreted. Hormonal influence and preparation-related morphology. The cellular composition of a cervical smear reflects the patient's hormonal status. Under estrogenic influence, squamous maturation is enhanced, resulting in predominance of superficial squamous cells with abundant eosinophilic cytoplasm and pycnotic nuclei. In progesterone-dominant states, particularly the luteal phase and pregnancy, intermediate cells become more numerous, and glycogen-rich navicular cells may be encountered. In contrast, hypoestrogenic states, such as childhood, lactation, and postmenopause, are characterized by reduced squamous maturation and increased exfoliation of parabasal cells. Cellular appearance also varies with the preparation method. In a conventional Pap smear, cells may show variable distribution, overlapping, and a background containing mucus, blood, and inflammatory cells. In liquid-based cytology, processing produces a thinner, cleaner preparation with reduced overlap and improved nuclear preservation. Although the background and architecture may differ slightly, the fundamental morphological criteria used to identify normal cells remain unchanged. Practical approach to identifying normal cervical cytology. Evaluation of a cervical smear should follow a systematic approach. First, identify the predominant squamous cell population, as this provides an immediate impression of epithelial maturation and the patient's hormonal status. Next, assess for endocervical and squamous metaplastic cells, which indicate sampling of the endocervical canal and transformation zone. The background should then be examined for normal accompanying elements such as mucus, histiocytes, inflammatory cells, red blood cells, and lactobacilli. These findings should always be interpreted in the appropriate physiological and clinical context. Throughout the examination, the most reliable indicators of normal cytology are uniform nuclear size, smooth nuclear membranes, finely granular chromatin, appropriate cellular maturation, and orderly cellular architecture. Although physiological factors may alter the proportion of different cell types, they do not produce the significant nuclear atypia characteristic of epithelial lesions. Before interpreting a smear as abnormal, always determine whether the observed findings can be explained by the patient's age, hormonal status, menstrual phase, pregnancy, or menopausal state. Careful correlation of cytological morphology with the clinical history remains a fundamental principle of cervical cytology. A sound understanding of normal cervical cytology forms the foundation of the Bethesda System. Only after the normal cellular populations are confidently recognized can non-neoplastic changes, epithelial abnormalities, and malignant lesions be identified accurately and reported with confidence.